Recent research estimates that more than 600,000 people in Australia may suffer from hoarding disorder. This is in line with the findings of studies in the US, the UK and Europe that estimate that between 2% and 5% of people may be living with hoarding disorder and in need of help. But what exactly is hoarding, and why is it considered a clinical disorder? And how can we better understand and address this increasingly widespread problem in our community? Simone Eisman and Jeanette Svela, two psychologists at Lifeline Harbour to Hawkesbury, are working to increase the availability of treatment of hoarding disorder within the North Sydney region through the training of professionals who are likely to come into contact with instances of hoarding.
Hoarding disorder is all about difficulty discarding. It's when the person is fearful, anxious and overwhelmed when they need to let go of some of their stuff. So as a result, they have a strong urge to hang on to their possessions, and more stuff starts accumulating in their home.
Movement in the rooms was not easy. There was too much stuff there.
Things just kept on piling up, and in the end it was just you could hardly walk down the hall.
Hoarding probably starts to become a disorder when that clutter seems to start overtaking the house, and you find that you can't get through the rooms easily. There's so much stuff, you might have to climb over things, there are boxes everywhere, and there is that level of social impairment or functional impairment, and it causes distress. It might not be obvious, but it does cause distress.
The people who live with you become disheartened and depressed.
That I haven't been able to have people come into my life.
I've needed help, as I haven't had a relative there. I've been there 27 years.
It's a wall between me and others.
If the people who live with you feel that you put objects in front of them, that you prefer to have your collection of stuff rather than have a conversation with them. So it's toxic. It's a toxic atmosphere. That's the worst thing.
Lifeline Harbour to Hawkesbury became involved with hoarding treatment following an approach from a local council.
3 years ago, there were no hoarding treatment programs available in northern Sydney. But a suicide related to hoarding prompted one of the local councils to approach Lifeline Harbour to Hawkesbury and ask for help with treating hoarding disorder. And that is how it really started for us.
They were looking for someone to start a treatment program to actually treat the person with hoarding disorder, not just tidy up the house.
When I first went to the group, the very first time, I wanted to walk out the door. But we were all feeling the same way. The look on our face was, what am I doing here? I don't know you. How can you possibly understand what I'm going through?
And it's fabulous. I mean, we talk like brothers and sisters. It's just, we are a family. You belong to, it's a family. It's a family affair.
It's wonderful, absolutely wonderful. We are each other's counsellors in a way.
It has been an incredible journey. It's given us insights into why it's happened. Not just how to fix something. You realise, we had a manual, we had homework to do every week. We realised how it all happened, how it came about.
Effective hoarding treatment substantially improves the quality of life, not only of the people who have been living with the disorder, but of those around them too.
Well, family are often relieved, even if they're not living with them. They've got a family member who's living unsafely or about whom they're very concerned. So it's a relief to see that this person acknowledges there's a problem and is actually starting to do something about it. So it helps improve relationships.
I actually had relatives at my place on Boxing Day last Christmas, for the first, well, my sister, I've been there 27 years, and my elder sister had never seen it. Never been there once.
And it's also good for the community. It's hard when your neighbour's stuff, there's too much of it, it's creating problems. So it improves neighbourhood relationships as well.
So generally there's a real reduction in conflict, whether it be within the family or within the community, amongst neighbours, amongst local councils.
Early on, Simone Eisman and Jeanette Svaler recognised that more needed to be done to help other organisations and other professionals who are increasingly coming across hoarding-related problems in their day-to-day work.
There is a need to train mental health professionals. Hoarding disorder is a relatively new mental health disorder, and there really is not a lot of trained professionals out there. And that is why we were really thrilled when we got an innovation grant from Partners in Recovery in Northern Sydney to offer the training to mental health professionals in our region.
And that includes people working in the field, people working in the homes of people with hoarding disorder.
And it's so important that every service provider is working from the same model, and that model is based on an approach that is related to a body of research evidence. That's really critical, that we have that consistent evidence-based approach. Lifeline Harbour to Hawkesbury has trained 117 mental health professionals, and that includes mental health support workers, case managers, psychologists, specialised nurses, occupational therapists, really anyone who is in the home helping to treat people with hoarding disorder, or out of the home trying to link them into services.
And also there were people from housing who came to the treatment program, and so it's important, I think, for people in the housing field to understand what hoarding disorder is and how to best approach somebody with hoarding disorder, so that you can properly treat the person rather than just treating the house problem. Because it is more than a house problem, it is fundamentally a person problem. We start with understanding hoarding disorder. So we look at the model that helps to explain hoarding disorder. It looks at the person's attachment to their things, information processing problems that might make it difficult to sort and discard, and also at the types of reinforcement people get when they acquire new things or when they have to discard something, because that can be quite overwhelming. We then look at how to engage the person, because it's very important to engage the person before you start to ask questions about why they might want to change, and then moving on to treatment options. How do you help the person to develop new skills, to practice behaving differently, to understand their attachment to things?
And the training is not just about theory, although that is important. It's also about how do you practically apply the theory to someone with hoarding disorder. And from our own experience, we've developed case studies which we use in the training, and there's plenty of chance to discuss the application with other participants.
Until recently, specialist resources to address this issue in our region have been extremely limited. Now, as the result of this training initiative, mental health support workers, community service professionals, and housing assistance providers can be equipped to work more effectively with hoarding disorder.
The training allowed us to significantly increase the capacity to treat hoarding disorder in our region. It's great that we run a treatment program, but that's really not enough. We need more people involved. There are lots of people out there with hoarding disorder who need treatment and want treatment.
Training your professionals now can enable your organisation to make real headway in working with hoarding disorder.
Other organisations do need to get involved with treating hoarding disorder. It really is a myth that most people with hoarding disorder don't have insight. there are plenty of people out there with an insight needing help around changing their behaviour. And what is also important is that the treatment that we offer is research-based, that there's a body of evidence showing that that treatment is effective.
It provides a consistent approach to treating people with hoarding disorder.
Last 22 months I've gone ahead leaps and bounds, and I'm not my possessions anymore. I'm not my clothing or my documents and all that. I'm who I am, and that's enough. It's just a different feeling to be in the present. I was like wrapped up, in knots, and now I'm not that.
And when I've come out of a group or a support group, I just want to race home and get stuck into it again. I just want to get there.
Hoarding isolates people. It makes them prisoners in their own homes. In extreme cases, it can be dangerous and disabling. But hoarding is far from being an isolated problem in our society. In fact, it appears to be on the increase. And it is a complex and challenging problem for those who are working to alleviate the disorder. The training that Lifeline Harbour to Hawkesbury is now able to provide can make a real difference in your community. It can do this by equipping your professional services and their employees with the skills and insights needed in order to better help those living with this isolating disorder. Hoarding disorder can be treated. People with hoarding disorder have complex needs and require long-term interventions to support their recovery. They don't have to live a life walled in by too much stuff.
It has changed my life completely. It has opened a new life.